Erythroblastosis fetalis, it's a mouthful, right? Don't let the long name scare you. It's important we understand this condition. It affects newborns and can be serious. But with knowledge comes power, and we can take steps to protect our little ones. In simple terms, erythroblastosis fetalis is a blood incompatibility issue. It happens during pregnancy. The mother's immune system attacks the baby's red blood cells. This is treatable, especially if we catch it early. This essay will guide you through the ins and outs of erythroblastosis fetalis. We'll cover what it is, what causes it, and how it's diagnosed. We'll also talk about why early detection is key. My goal? To empower you with the knowledge to make informed decisions about your health and the health of your future children. Let's get started. Imagine a microscopic battleground. On one side, we have the baby's red blood cells, carrying oxygen throughout their tiny body. On the other side, we have the mother's antibodies, mistaking these healthy cells for invaders. Here's what happens. The mother's antibodies cross the placenta. They enter the baby's bloodstream. These antibodies attack and destroy the baby's red blood cells. This leads to anemia, a condition where the blood can't carry enough oxygen. This lack of oxygen can cause serious problems for the baby. It can affect their growth and development. In severe cases, it can even be life-threatening. But remember, this condition is treatable, especially when we catch it early. Erythroblastosis fetalis is all about blood types and how they interact during pregnancy. Specifically, it's about something called the Rh factor, which plays a crucial role in this condition. The Rh factor is a protein found on the surface of red blood cells, and it determines whether your blood type is positive or negative. People are either Rh positive, meaning they have the Rh factor, or Rh negative, meaning they don't have this protein. Problems arise when an Rh negative mother is pregnant with an Rh positive baby, leading to potential complications. During pregnancy, some of the baby's blood can mix with the mother's, especially during delivery or any trauma. If the mother is Rh negative and the baby is Rh positive, the mother's body sees the baby's Rh factor as a foreign invader, triggering an immune response. This immune response causes the mother's body to produce antibodies against the Rh factor, which can be harmful. These antibodies can then cross the placenta and attack the baby's red blood cells, leading to serious health issues for the baby. It's important to note that this usually doesn't affect a first pregnancy because the mother's body hasn't produced a significant number of antibodies yet. This is because the mother's body doesn't produce a significant number of antibodies until after exposure to the Rh factor, which often happens during childbirth. However, subsequent pregnancies with Rh-positive babies are at risk because the mother's body is now primed to produce antibodies more quickly and in larger amounts. Erythroblastosis fetalis can manifest in a variety of ways, and the severity can range from mild to severe. This condition, also known as hemolytic disease of the newborn, primarily affects the red blood cells of the baby. Some babies may show no symptoms at birth, while others may experience noticeable signs that require immediate medical attention. Here are some of the common symptoms to look out for in newborns affected by this condition. Jaundice. This is a yellowing of the skin and whites of the eyes. It is one of the most common signs and can appear within the first few days of life. It's caused by a buildup of bilirubin in the blood, a byproduct of red blood cell breakdown. High levels of bilirubin can be toxic and need to be monitored closely. Anemia. This occurs when the baby's red blood cell count is low. Anemia can lead to a lack of oxygen in the body, which is crucial for the baby's development. Symptoms include paleness, fatigue, and shortness of breath. These signs indicate that the baby is not getting enough oxygen. Enlarged liver or spleen. These organs may become enlarged as they work harder to remove damaged red blood cells from the bloodstream. This can be detected through physical examination and imaging tests. Fluid buildup, edema. This can occur in the baby's tissues and organs, causing swelling. Edema can be a sign of severe complications and needs prompt medical intervention. Heart problems. In severe cases, erythroblastosis fetalis can lead to heart failure. This is a critical condition that requires intensive care and monitoring. It's important to note that these symptoms can also be signs of other conditions. Therefore, a thorough medical evaluation is essential for an accurate diagnosis. That's why it's crucial to seek medical attention if you notice any of these signs in your baby. Early detection and treatment can significantly improve outcomes for affected infants. Section 5. The tiny clues, diagnosing erythroblastosis fetalis through lab tests. Diagnosing erythroblastosis fetalis involves a combination of medical history, physical examination, and a series of laboratory tests to ensure accurate diagnosis. Here are some of the essential tests doctors use to diagnose this condition. Blood typing and Rh factor testing are crucial initial steps. This is done on both the mother and the father to determine their blood types and Rh factors. Antibody screening is another important test. This test checks the mother's blood for the presence of antibodies against the Rh factor, which can cause complications. Amniocentesis is also performed. This procedure involves taking a sample of amniotic fluid from the womb to check for bilirubin levels, which can indicate the severity of the condition. Fetal blood sampling is another diagnostic tool. In some cases, a small sample of the baby's blood may be taken from the umbilical cord to check for anemia and other problems, providing critical information. These tests provide valuable information about the baby's health and help guide treatment decisions, ensuring the best possible care for both mother and child. Section 6. Protecting the most vulnerable. The importance of prenatal care and early diagnosis. Early detection is absolutely crucial when it comes to erythroblastosis fetalis. Prenatal care is essential for all expectant mothers, but it's especially vital for those who are Rh negative. During your prenatal visits, your doctor will perform blood tests to determine your blood type and Rh factor. If you're Rh negative and your baby's father is Rh positive or his Rh factor is unknown, you'll receive injections of a medication called Rh immune globulin, or RhoGAM. RhoGAM works by preventing your body from producing antibodies against the Rh factor. This medication is incredibly effective in preventing erythroblastosis fetalis. Early diagnosis allows for prompt treatment, which can significantly improve outcomes for babies. Section 7. Advancements in treatment. Hope for the future. The good news is that erythroblastosis fetalis is highly treatable, especially when diagnosed early. Treatment options vary depending on the severity of the condition, but they may include intrauterine blood transfusions. In severe cases, blood transfusions can be given to the baby while they are still in the womb. This helps to correct anemia and reduce bilirubin levels. Phototherapy. After birth, babies with jaundice may be treated with phototherapy. This involves exposing the baby's skin to a special light that helps break down bilirubin. Exchange transfusions. In some cases, a baby may need an exchange transfusion. This procedure involves slowly replacing the baby's blood with donor blood. Thanks to advances in medical care, most babies with erythroblastosis fetalis go on to live healthy lives. Section 8. Beyond erythroblastosis fetalis, the importance of blood compatibility. While erythroblastosis fetalis is a specific condition, it highlights the broader importance of blood compatibility in health and medicine. Understanding blood types is crucial in various medical situations, such as blood transfusions and organ transplants. When a person receives a blood transfusion, it's essential that the donor blood is compatible with their own. If incompatible blood is given, it can lead to a potentially life-threatening immune reaction. Similarly, in organ transplantation, matching the donor and recipient's blood types is essential for a successful transplant. Section 9. A global perspective. Erythroblastosis fetalis, incidence and prevention programs. Erythroblastosis fetalis was once a leading cause of infant mortality and morbidity worldwide. However, due to advancements in prenatal care and the widespread use of RhoGAM, its incidence has significantly decreased, especially in developed countries with well-established healthcare systems. However, in developing countries with limited access to healthcare resources, erythroblastosis fetalis remains a concern. Public health programs focusing on prenatal care, blood type screening, and RhoGAM administration are crucial in these regions. Section 10. The power of knowledge. Empowering expectant parents. Knowledge is power, especially when it comes to your health and the health of your future children. Understanding erythroblastosis fetalis, its causes, symptoms, and treatment options empowers expectant parents to make informed decisions about their pregnancy and their baby's well-being. Don't hesitate to ask your doctor any questions you may have about blood type compatibility, prenatal care, or any concerns you have about your pregnancy. The more you know, the better equipped you'll be to advocate for yourself and your baby. Section 11, Conclusion, a call to action. Erythroblastosis fetalis is a reminder of the intricacies of the human body and the importance of early detection and intervention in medical care. While it can be a serious condition, it's highly preventable and treatable, especially with advancements in modern medicine. By understanding the causes, symptoms, and diagnostic tests associated with erythroblastosis fetalis, we can work together to protect future generations. As a medical professional and advocate for patient empowerment, I urge you to prioritize prenatal care, ask questions, and stay informed about your health. Together, we can create a brighter future for all.